I have had nurses collapse because they were not medically qualified to handle the restriction. It is known, and I can send you these studies showing the potential for oxygen impediment and the improper gaseous exchanges that are not letting our body exhale the toxicants in our body. When we talk about these fit tests, I could pass a nurse on a Honeywell. These are brands of respirators. Honeywell, but she'll fail on a 3M, or she might pass on a Kimberly-Clark. So you have people that have tried 3 different respirators, only pass on one. When I say pass, I mean it's the respirator's ability to actually protect the wearer.
So I'm going to interject. Committee, is there any questions yet at this point before you continue? Because we've heard a lot.
Yeah, that's okay. We are also very willing to take questions together at the end, or we can do it throughout.
Doesn't look like I have any questions, so I'd say continue.
And then I want to also, this is Chris Megan Kelly again. I'm trying to get my composure. I'm sorry, this is hard for me to talk about. And I'm a little shaky this morning, not from being nervous. I give these speeches. I've gone against the CDC. I had to fly here in a private plane, and I'm still dealing with a little vertigo flare-up. When you implement, and when I say you, I mean as a society or government bodies, mandates facial coverings for everyone, we have a problem with communication between different government bodies and businesses. What I mean is, the Americans Disability Act has case precedents and has already said there's a difference between a medical intolerance and a disability in which you cannot tolerate covering your face. I am one of those people. I've held a respirator and mask exemption since 2013. I am actually rated as 100% totally and permanently disabled veteran by the Veterans Administration. I was raped, I was sodomized, I was cut, I was harmed. I had my face covered. Since that day, it's been very difficult to cover my face. It's a trigger. I've passed out. I have heart palpitations. And my response to having my face covered even requires me to be under IV sedation to have my teeth cleaned. I have been denied access to medical facilities and took litigation to be allowed to go in with a plastic face shield I can't tolerate. The amount of people that have had suicidal ideation, actually committed suicide, or are dying in my home state of Michigan because they are being denied medical care because of these mask mandates across the country. I was trying to board a flight yesterday for Delta that has a clearance to fly program. They have a program in which if you have an ADA protected disability in which you cannot don a mask, you go an hour early, you talk to an on-call doctor. Now, we gave a similar presentation in Miami, and I've already flown on Delta with this exemption. I showed up yesterday to the Grand Rapids airport, talked to the doctor, and all of a sudden my disability didn't matter. I was literally told, as long as I had ears and wasn't on oxygen and didn't have Down syndrome, there's no exemptions. This then went to Delta Corporate, in which Delta said this is incorrect. So we had a major issue with a contract doctor contradicting the policy of Delta. Long story short, we ended up hopping a private plane, and I'm still recovering. I am one story, and I am a very strong person. But the amount of messages that I get from people who are telling me I have a brain tumor and no doctor will see me. People are dying. We've had elderly people pushed out into freezing temperatures because they can't don a mask. We had an elderly woman who was locked in a dirty room in hospital where they keep dirty linens, waiting for a x-ray because they didn't want her sitting. She was on auction. They did not want her sitting in the waiting room. This type of discrimination is that is the real epidemic in this country. The discrimination for people who cannot wear masks. As someone who has fielded respirator and mask exemptions for 18 years, the list of why people cannot don a mask is very long. Some of those reasons are a history of bronchitis, asthma, PTSD, claustrophobia, anxiety, cancer, stroke, and I'm also a stroke survivor. There is a long list of issues. If I were to estimate, there's about 73 reasons that medically disqualify you from being able to don a mask and a respirator. The reason that is in place because it puts the onus on the employer as a liability if something happens to that personnel. I have had people collapse in the past year calling me, asking me to act as an expert witness on their litigation because of this discrimination. You may not see the harm that these mask mandates can cause to the disability community, but it is a major issue. And as hard as it is for me to tell my story, I need to tell my story because I need to put my face to the story. I don't like having to tell a group of people what happened to my body. I don't like telling people about my disability. Sadly, some people use this against me, as if I don't have mental clarity to talk about a profession I've held for almost 20 years. One thing when you are instituting a mask mandate, in my profession, anytime you're going to tell somewhere to wear any PPE or any source control, mask, gloves, you name it, firefighters wearing SCBAs, the industrial hygienist is the one that selects it by conducting a health risk assessment. The first thing I ask myself, is it safe? To determine if it's safe is based on an individual health risk assessment. Yet we have millions of people in this country forced to wear masks without an individual health risk assessment. You might be someone who does heavy exertion. You can have a situation where the mask creates a greater hazard, and thankfully the CDC finally put this into writing. That if you conducted a workplace health risk assessment showing this mask creates a greater hazard, you are exempt. That is something I'm very grateful for. I had people that were working electrical lines, wiring electrical, and these are not fire retardant masks. One arc flash and they will catch fire. So the second aspect is then, is it effective? And we're going to now gear into, are these masks effective? But just to further reiterate, I could not get past number one. I cannot say a mask mandate is safe because I do not know all of you in this room. I do not know your individual health histories. It would violate the ethics of my profession to just tell you to cover your face without knowing your individual stories. And not just your individual health history, but what will you be doing when you're wearing the mask?